Hello and welcome to this second edition of the My HCP Standards webinars that we are doing. We're doing a series of 10 at the moment, each exploring one of the standards from the standards of conduct, performance and ethics. Today, our focus is going to be on standard 2, communicate appropriately and effectively. And if you missed the first of this webinar, so this is the second version, so if you missed the first one, we provided in your joining instructions today a link to the first one which was recorded, and so you're able to catch up with that one at your own time. So today, one of the things we're talking about today is looking briefly at the HCPC role and standards. We're going to explore how you apply your professional judgment when making decisions, but particularly difficult decisions. We're going to explore standard 2 of the standard of conduct, performance and ethics. And in particular, we're going to be looking at communicating with service users and carers and the current challenges around this when working remotely and in PPE. We're also going to look at social media and really how to avoid problems when using social media. Just before we get really stuck into that, I've got a couple of housekeeping bits for you. We can do questions and answers throughout. The Q&A box, so the live chat box, has been monitored by colleagues Holly and Olivia, who will introduce themselves very soon. During the webinar, I'll pause a couple of times just to allow you to post questions as we go. So do type these in the chat box and hopefully you'll be able to answer them as we go along. The slides from this webinar will be made available to you after the event, so we will send them on to you. And we are also recording this webinar and we're going to make that recording available to you too. So there's no real need for you to keep notes as we go. You're welcome to just sit back and enjoy today's webinar at your leisure. Within the Q&A box, so in the chat box there, we're also going to put some useful links as we talk about different resources as we go through the webinar. So we'll pop the links to those in there. They're all online and you can, again, access those in your own time. And we're going to aim to finish around 50 minutes so that we all have a good time to get our evenings started. We are going to be using a polling software called Slido. And there were some instructions emailed to you just before this event from my colleague Holly. And I'll give some more instructions very shortly for that, but it'd be really great if you can join us in that polling and join in, answer some of the questions that we put to you today. So, hello, my name is Kelly Green and I am the Professionalism and Upstream Regulation Lead at the Health and Care Professions Council. I have been working with the council now for a few years now, and that's predominantly been in fitness to practice, and I took up this role in May. Really enjoying this role. This is very much about getting out and meeting people. When I say getting out, of course, what I mean is virtually getting out at the moment. It involves an awful lot of engagement with yourself as registrants and also your employers. So I'm just now going to go to colleagues who are joining me on the call here, and I'm going to start with Olivia. And Olivia, I'm hoping people will be able to hear you, so perhaps you could just introduce yourself.
Yep. Hi everyone, my name is Olivia Bird and I'm a policy manager in the Policy and Standards team. So my role involves writing and reviewing the standards that we're going to be discussing today, and I'm going to be helping Kelly with some of your questions throughout the session. So looking forward to answering them.
Thanks very much, Olivia. And also joining us today is my colleague Holly Butler. So Holly, would you like to say hi?
Yep, sure. My name's Holly Butler. I am the Events and Communications Officer at the HCPC. So I help to organise a range of different events throughout the organisation, face-to-face and obviously most recently virtual. And I also help the communications team with, different activities. Yeah.
Thank you very much. So that's Holly and Olivia, both on hand today to answer your questions as we go. So I'm just going to run through very quickly, just at the start here, some GDPR stuff. We just wanted to let you know how we'll use the information that you've shared with us for this event. So the personal details that you've provided to register for this event will be used for this event only. That's the registration stuff and the post-evaluation stuff that we will send to you after the event. You can post questions in the chat box, and we'd really encourage you to do that. If you choose to provide your name for these questions, then they will be visible for others to see. So we just wanted to let you know that others will be able to see who you are if you've included your name. We may use some of the answers and comments that you give to us for the polling, for some analysis, some learning and evaluation for us. And some of the comments we might use in our marketing material, but they will be anonymised. So we might just use quotes and things sometimes to talk about how you viewed this event. So I just wanted to let you know about those things before we really get started. And now we're going to have our first go at Slido. So you need to go to the browser, the Slido browser, the website details are there on the slide, and enter the event code MyHCPC Standard 2, and that's all one word and all lowercase. That should take you to the first question, and I'm just going to now give that a go. And hopefully you will get to see the first question on your screen very soon. So our first question really is just asking, it's nice and easy, asking you which professional group do you belong to. It's really good for us to know who's joining us today. Can be a little bit of a delay in the results though, so it might take a few moments before you start to see the results appearing on your own screen. I can see some coming in now, and I see we've got quite a lot of paramedics with us today, physiotherapists, got radiographers. So I'm just going to move this so I can see my screen. Some practitioners, psychologists, speech and language therapists. So we've got a really mixed group, which is absolutely brilliant to see. Okay, so you do need to bear with us just slightly with the Slido stuff. There's a slight delay that comes through, but if you do hang on there, that would be great. So still got a few more answers just coming in. That's brilliant. So still got a really mix of people joining us today, and it's absolutely brilliant to see you all. So I'm now just going to move on to the next Slido question. So stay where you are, and this one will give us a bit of a word cloud. Sorry, just bear with me. I seem to be having a bit of difficulty getting the Slido now to work. Okay, I'm just going to move on from that, I think. And we'll get started by talking about the standards. Okay, so you're all going to be quite familiar with our role. You're obviously registered with us, and so you have a good understanding of what it is that we do. But we are, just for clarity purposes, the statutory regulator, regulate 15 different professions, and of course a lot of you are joining us today. And our role is to protect the public and maintain confidence in the professions that we regulate. And we achieve this by quality assuring education, so the training and education for future registrants, maintaining and publishing a register of professionals who have demonstrated that they meet our standards, setting appropriate standards, and responding to fitness to practice concerns and taking action to protect the public when necessary. We do publish 4 sets of standards. These are designed to enable you to practice safely and effectively and meet your high professional standards. We have the standards of education and training, that's the green book that you can see there, and that's the one that we use to assess the education programmes against. Students hopefully graduating from those education programmes will graduate with the necessary skills and knowledge to meet the standard of proficiency for their chosen profession. Each profession has its own standard of proficiency, and I will say that we are currently proposing to make changes to those, and we're consulting on them at the moment, and we'll provide more details of those consultation process towards the end of this webinar. The standard of proficiency really sets clear expectations of the knowledge and abilities you should have when you start to practice your profession. And I'd emphasise there really that what we're talking about is at the point that you enter your profession, and your scope of practice is likely to change as your career progresses. And the important thing to do is really just to keep in touch with that standard of proficiency, to make sure that the skills and knowledge that you retain as you develop your scope and your career still keep you in line with that standard of proficiency. We of course have standards of continuing professional development. That's something that you all do, or continually develop your skills and your knowledge, keeping those up to date as you go through your career. And these are the standards that we use really to assess your own CPD. Standards of conduct, performance and ethics. So these really outline what service users expect from you. There are 10 standards. This series of webinars is going to explore each one of those in turn. Today's focus is on standard 2, which is about communication. The standards themselves are not prescriptive, but instead provide a high-level framework within which you should practice. So this gives you the autonomy and flexibility that you need in order to practice in the way that you do. How you meet them and what is not appropriate for you will depend very much on the circumstances of your individual practice and the context in which you're working. So that's why we quite often say to you that you need to use your professional judgment when you're looking at the standards and applying them. So what do we mean by professional judgment? Well, this is really when you apply your knowledge, skills and experience in a way that's informed by your professional standards, the laws and local policies and procedures that govern your practice, to develop an opinion or decision about what should be done. Applying your professional judgment to a range of issues. I mean, you're doing that every day. You do it quite instinctively. You're quite often thinking this through, using the knowledge and skills that you have to reach the decision. And so most of the time you can reach your decisions really easily, but sometimes you can have more difficult decisions, and it might be more difficult to weigh up really what is the right option to do. So the bullet points that have been popping up as we've been talking there really take us through a process that allows you to reach those sound decisions, sound decision making when you've got those more complex scenarios in front of you. So I think really some important things to take out there is to make sure that you have all the information that you need to make a decision. So seek that information if it's not forthcoming. Think about what it is that you don't know. So what is it that you need to try and work out before you can really reach a safe, sound decision? Think about the risks and the solutions. Always try and put safety first and base your decisions on any available evidence that's there. Consider the preferences and needs and wishes of the people that will be affected by your decision. So what impact will it have? You can call on colleagues, managers to help you with the decision-making process. You know, we don't often have to make decisions on our own. We all generally are part of a team. We all generally have managers around us and stuff. So we can share some of the issues with our colleagues or our manager and help talk them through and help reach decisions together. I think one thing to bear in mind is there's not always an obvious right answer. Sometimes we're applying judgment, and that means we're in a realm of what's reasonable, really. And I think it's also important probably for us to remember that we're going to sometimes make the wrong decision. We are not always going to get it right. So I think what's important really is that we consider all the facts, that we seek support if it's available and we need it, and that we make the best decision that we can. The final thing really to say is when you are making those really complex decisions, it's good to record it, record the decision that you made and the reasoning behind it, so that if you're challenged at a later date, you'll want to remember why you reached that particular decision, what you took into account when reaching it, and the decision that you then ultimately came to. So I'm going to try with Slido again. Bear with me, because a moment ago it wouldn't switch to the next question, but I'm just going to try and see if it will help us. Okay, I think we're on. How would you rate your current knowledge and understanding of Standard 2 of the Health and Care Professions Council Standard of Conduct, Performance and Ethics? So what I'm asking you here is to tell me really at the moment, so before this webinar, how comfortable are you about the contents of Standard 2? How familiar are you with it? Could you tell me what 3 components of that standard are? And if you can pop your answers into the Slido count, that would be great. So remember to bear with us just slightly, because it can take a moment for the scores to come up, and I need to move my just slightly so that I can see the results as they come in. So we've got quite a few people feeling fairly confident at numbers 7 and 8. Some people at 10 being really the highest, so you people are feeling very confident about the contents of Standard 2. And then there's a few now around the kind of middle ground there, some not so confident about it, others feeling really confident. Okay, so really mixed views there. So for those of you who are feeling really confident, I'm pleased that you've still chosen to join us today to refresh your knowledge and just to keep that up to date. For those of you feeling less confident about it, well, we hope by the end of this webinar that you will begin to feel a little bit more confident about the contents, understanding them and how to meet them, particularly in these really difficult, challenging times. Okay, so we'll go back to the presentation. And we can get stuck in to what is Standard 2. So really, as mentioned, Standard 2 falls into 3 main parts. We've got communicate with service users and carers, work with colleagues, use social media and networking websites professionally. Today, our focus is going to be on the first part of that, so communicating with service users and carers. And really we're going to explore the challenges of remote consultations and also communicating when using PPE. And we're also going to look at social media, and we're going to explore how we can keep our social media professional and some of the challenges we've seen there. So looking now at that first part, communicating with service users and carers. Well, this has a number of requirements in there for you. First one really is that you remain polite and considerate all of the time. Listen to service users and carers, taking account of their needs and wishes. That we give service users and carers the information they want or that they need, and in a way that they can understand. So we're avoiding the use of jargon, using simple language where necessary. And ensure that where possible that the language and communication needs are met. So that would be things like arranging for interpreters, sign language, writing things down for people, or recording what you say and allowing people to take that away with them. So I'm going to jump straight in with remote consultations and some of those challenges. Now, you're not alone. Many of us are working in very different ways as a result of the pandemic at the moment. We're all working remotely, got very little face-to-face contact and engagements with other people, and we've all needed to develop new skills to be able to achieve this. That's not only the technical skills, but our communication skills too. Now, the pictures that you can see on the slide are of me. They're me delivering the this My HCP Standards workshop in March. And this was about a week, 10 days before we went into lockdown. And what you can see in the photos is how I'd normally do it. I quite like standing when I'm presenting. I like to walk around the room, make eye-to-eye contact with people. I use my hands quite a lot, facial expressions, and I use body language to get my message across. Today I'm sitting at a desk in my spare room rather, and I'm talking to a screen. I can't see you. I can't judge from your expression or body language whether you're agreeing or disagreeing with me, whether you're keeping pace with me, whether you're actively listening to me, or whether you have popped off to make a cup of tea and you've just switched me off completely. I may not be talking to anyone. I just don't know. It'd be really nice, I think, at this point, if you could maybe give me a thumbs up or down, if you prefer, in the chat box. You can just let us know that you're there and listening. So all of this makes my job communicating with you much more challenging. Getting my messages across to you is harder. So, you know, it's the same for you really now with the way that you need to work, even remote consultations, and also with PPE. But, you know, the benefits of remote working and remote consultations are definitely being seized upon by our employers. Video consultations were part of the long-term vision for the NHS in all parts of the UK. And I think it's the pandemic really has just meant that this has happened much quicker than perhaps we planned. So it's been rolled out, the technology has been rolled out really quickly. We've all had to start using it with a day or two's notice. There's a platform in Scotland called Near Me. It's an online video consulting service that's operated up in Scotland. It's been available for some years and used mostly in rural Scotland and in the islands. And just to give us a sense of the scale of things, really, in February 2020, there were around 300 Near Me consultations per week happening in Scotland. By June, this figure had reached 17,000 per week. So we've gone from 300 to 17,000 within the space of a few months. And it's quite a significant change, big increase in a very short space of time that we've all been grappling with. Now, Near Me and the Scottish Government have carried out some engagement exercise really to better understand the benefits and barriers of using video consulting. So that's for both for members of the public as well as people like yourself, clinicians and stuff as well. So general public, it responded to this and were involved in that engagement exercise, and that included people with learning and other disabilities and those whose first language was not English. They gave their responses as reviews, and a range of healthcare professionals also responded, and this included physiotherapists, speech and language therapists, psychologists, occupational therapists, dietitians and podiatrists and optometrists. So getting some good different ranges of views in there. They published their report in September. So it's a very recent report that's come out, and Holly's going to kindly put the link to this report in our chat box for you. And I think what this tells us is that from 5,000 responses, there was a strong support for the use of video consulting for health and care appointments. But 87% of the public and 94% of the clinicians responding thought video consulting should be used. Main benefits that were identified included improving access and convenience and reducing the risk of infection, and that's really was very focused on COVID-19 infection, so reducing our risk of infection for that. A few barriers definitely identified, and these included digital connectivity, so Wi-Fi quality, people's access and use and the ability to use Wi-Fi, access to the equipment as well. So, you know, having access to a smartphone or a tablet to be able to do that. And it recognises that some people are excluded because of that. So they're unable to use or access the equipment that they needed. And this was often because of a disability, because of age, or because of homelessness or the community in which they lived in, or some social economic positions as well. So it's not something that's available for everyone. One of the other barriers was a lack of private space, and that's private space for both the patient as well as the clinician, the practitioner as well. And they found that private space was really challenging for younger people to find, so those who were living with others, people with disabilities, and also people who are living in situations where there may be some domestic abuse. Another barrier that was identified really was that it can have a lack of inclusive communication. So especially for people where English is not their first language, people with learning disabilities and those with low literacy skills. So this rapid change, you know, has been happening, and there is a real need, and has been a need for obvious reasons, to move things online, and we're all kind of getting to grips with that. And there's things that are happening now to really explore those challenges that this presents and how we might overcome them. You, of course, consulting in this way or attempting to treat people through these remote means, you still need to achieve the standards when consulting with your service users. So you still need to achieve standard 2. So I think let's just have a look. We all know non-verbal communication is really an important part of the exchange of information we have. Is often vital to establishing trust, And we've looked at some work done by the Health Foundation. For some years now, about 10 years or more, they've been supporting several teams across healthcare to develop, test and develop and use video consultation. And the learning that they've shared really from this is that video consultations work best, really according to service users, when they're able to engage really with a familiar and trusted face. So if you are someone who's using remote consultations and you're doing it with existing clients and patients and they have some familiarity with you, then you're really getting off to a better start with those. More challenging for those who don't have that relationship with. The quality and flow of video consultations has been found to depend very much on the degree of shared knowledge and common ground between patients and clinicians. Effective communication through this medium was seen to follow on from really strong existing personal positive interpersonal relationships that you might already have. So building a relationship of trust with new service users is important. If you can begin with face-to-face appointments to begin that relationship building, then that can always help, and then follow up with video consultations. If you can't do that, and it is really difficult at the moment, then be aware of the need to build that trust and relationship with people, and perhaps allow for a little bit more time for all those initial video consultations that you're having. Empathy, so they looked at empathy really, and we all know that that's quite an important component of effective communication, particularly in health and social care. Empathy is associated with a range of benefits, patient satisfaction and outcomes, and there's been studies before that have shown us that when clinicians demonstrate empathy, patients will disclose more information to you. They're much more likely to adhere to any medication or advice that you give them. But it can be quite challenging, can't it, to show empathy online? It involves some kind of attunement with the patient, so it requires us to be able to pick up on and use a range of verbal and non-verbal cues, and these can get easily lost in remote consultations and communication. I think video consultations have an advantage over telephone consultations for being able to detect those verbal cues, but it can still be quite challenging, as we've discussed already. So how might we overcome some of those challenges of building that relationship, having that empathetic relationship with people? But I think one of the things we talk about here is what you might be able to do before remote consultation. So communicating with people can begin way before the actual consultation itself. You can email, send out details that help you become that familiar and trusted face. Provide information about you and your name, professional picture of yourself, perhaps your qualification, your services. Provide links to any website that you have that's already in place, any online materials that will help the service user or the carer or their family member know who you are and what it is that you can do. Encourage service users to tell you in advance of any special needs or requirements that they might have, such as a hearing or visual disability, the need for a translator, the wish to have someone present during their consultation. If you have that information in advance, you can obviously start to make arrangements where necessary to meet those needs, you know, remembering of course that we have those requirements to make reasonable adjustments to ensure that access to your services is there for those that need it. You can provide your service user or their carer with clear instructions on how to connect with you, the date and time of the appointment, what to do if they cannot connect with you at the time. So if you've got some technical problems or anything, then perhaps suggest we revert to the old-fashioned telephone call, but they have some other means of contacting you so that if the connection doesn't happen, they can't actually get online at the time they need to. Make sure that you can be in a location that's private and quiet. Think about your backdrop and whether you've got anything on show behind you that might breach confidentiality, might perhaps be considered inappropriate for a consultation. Before the consultation, explore service user. You could explore the service user's history with them and their records, if available. Consider whether you can obtain any information on that from them beforehand. It's possible perhaps to send a short questionnaire by email asking for some key information, current symptoms, previous treatments that might help you get off to a really good start. And I think really above all, be open and honest about any limitations that the remote consultation will place on your ability to treat. There is going to be, in some cases, a limit as to what you might be able to do remotely, depending on your profession and what it is that you do. So I think it's important that you explain those to anyone that you're looking to have consultations with. It doesn't mean that there isn't a benefit from meeting with you in this way, but there might be some limitations, and letting them know about those in advance just helps to manage their expectations. So let's have a little look at during. This is, you know, one whole kind of flow of things here. So when you've got to the consultation itself, I think it's important really probably to begin by checking that you can be seen and heard, that everyone can hear you, that needs to be able to hear you, and that you can hear the service user. If there's family and carers, carer, family member, translator present perhaps, then you need to make sure that you can hear them too and they can hear you. It's always good to check who's in the room with your service user and that they're happy to proceed if there is another person there. Rearrange if they say that they are uncomfortable, or even if they really seem uncomfortable and reluctant to proceed with you. They may not be able to say that they don't want to proceed, but if they're showing signs of looking uncomfortable, then be conscious of that and maybe think about whether or not you could arrange it for another time. Obviously, make sure you introduce yourself, provide a little bit of information about you, your qualifications and the work, etc. that you do. You know, remember, you're continuously building that relationship and that trust that will help. If you're joined by a colleague, introduce them, make sure that their role is explained and the person knows who they are, so I don't think it's just that maybe somebody lurking around in the background. Provide some reassurance that the consultation is confidential and secure, and that it will, as far as possible, follow a usual format that you would do if you were meeting with them in person. Again, reiterate any limitations that there might be, given that you're doing this remotely and not face-to-face. I think it's important to check the service user understands these things, check that they're happy to proceed once you've gone through some of this stuff. Reassure them, I think, as well, that you'll be listening to them all of the time. Even if you do look away from the camera and screen, you know, tell them that you're probably going to be making some notes as you go, and say what you might be doing is, you know, looking down, looking away at that point to try and write things down. Listen. Now, it sounds very obvious, but I think we're all guilty of not fully listening to others, and our ability to listen can be reduced. Certainly if we're in different locations, reliant on technology, have other noises going on around us, using headphones, etc. So show that you're actively listening, nod, use some facial expressions. Verbal expressions need to be used much more. So say things such as, you know, okay, I see, you know, acknowledging as they're talking to you. So doing that active listening, repeating back some of the important things that you're told. So, for example, you know, saying you've had this for 2 weeks now, and express your empathy verbally as well. They're not going to be picking up on it so much because of the remote consultation as they would if they were in the room with you. So use verbal expressions of empathy as well. Well, I mean, they would be things like perhaps saying, I'm sorry you're feeling like that, or this must be really difficult for you. So display that empathy so that they can see and hear it. Speak slowly and clearly. I'm just going to take that check for myself. Check understanding as you go. So make sure that they're keeping pace with you, really, and check in every now and then, maybe get them to repeat something back to you just to make sure that they are understanding what it is that you're doing. Now, I know many of you probably use diagrams when you're explaining things, or a model. You can still do that, obviously. Use that, share a screen if perhaps you're using a diagram of a foot and you want to be able to point to certain parts or structure of a spine, for example. Continue to do this where you can. And I think then before you conclude the consultation, summarise what's been covered, confirm any actions that you or the service user will do after the consultation, check whether they've got any final questions or anything for you, or if they need any more information or clarification before you end the consultation. And then I think at the end there, what you really want to be doing is making sure that you have a really clear goodbye before you shut down. So there is a proper end to it, and you do say that goodbye, I'm going to log off now, I'm going to shut this down, and then shut it down rather than abrupt ending to it. Obviously make notes, make your usual notes that you would make, so recording the consultation as you would normally, but I think what's also important here is to make sure that you do record that it was done virtually, it was done online, the format that you took, and you could also attach to that any before or after communication that you have with the patient. And that's important when some of those things around the limitations that you have explained and that they were agreed to and accepted by the patient. So after, well, it continues. Your communication can continue afterwards. And again, this is all about really reassuring that patient and making a client and making sure that they understand who you are, what you can do, and they build that trust in you and that interpersonal relationship. So carry on your communications afterwards. Send something to follow up. If you'd normally send your client away with perhaps some written information like diet plans or exercise sheets, then obviously you can send these on to them by email, post, whatever is the most appropriate way to get it to them. Confirm any outcome of the consultation, so whether that might be a need to see you again, further follow-up appointments, or whether there's onward referral to another professional. It's helpful to just confirm that to them afterwards. You could, of course, seek feedback on the consultation so that you're continuously building your own skills for doing this and learning from patients and clients as to how effective it was for them, what difficulties they might have had, and then you can overcome them either for that individual or more generally for your clients. Provide details also, if you're going to see them again, it's good at that time to just provide those future consultation details. Again, perhaps reminding them if there are going to be any limitations as to what you can do, whether it will be remote, how they see you, and also how they might contact you in the meantime. So I think thinking of that consultation process from before, during and after could be really helpful in the communication at the moment, particularly when we're working in this pandemic. Now, we recognise absolutely that you're working in really, really challenging times, and just wanted to highlight here for you, we've got a COVID-19 hub. If you haven't already seen it, it does provide a range of resources to support you to meet the standards during the pandemic, as well as information about our services, what we can and can't do. Now, Holly, I think is going to share a link in the chat box to the COVID-19 hub, so you can see where it is on our website. You can access it from the homepage. It's very easy to find. And in there we have some particular information about communicating during the COVID-19 pandemic. And I just wanted to highlight some of the points from that, but go in and have a look at it in full yourself. So as you adapt your practice, make sure you explain your approach to infection control and personal protective equipment, including how you've adapted how your adapted practice may limit the types of treatment you can provide. We talk about the fact that really many carers and family members will not be able to be present with service users at this time. It's likely you'll need to update them remotely. There's information that links to sort of that. I think in here we've got information also that links to the high-level principles for good practice in remote consulting and prescribing. So if you are someone with prescribing responsibilities, do have a look at that as well. That's another link that Holly's going to pop into the box. Now I'm just going to pause for a quick second here just to allow you to post any questions in the Q&A box if you want to, so that as I say, Holly and Olivia are there to help them. So I'm going to pause just for a second and do post questions there if you have them. Okay, so I'm going to very quickly just mention something called Sage and Time. It's a model that you may already be familiar with, but we just wanted to highlight it here. It's a mnemonic really that provides a memorable structure for conversations that's based on evidence behind effective communication. And it was developed some years back now by the University Hospital of South Manchester, by some clinicians and a patient there. And it was really to teach core skills in dealing with people in distress. It's a good tool. It's available online. If you just search for the Sage and Time thing, you will find it. It's in this bright green image. Have a look at it. It's particularly useful if you are dealing with people who are in distress. Now, personal protective equipment, something we've all had to get used to. Can't shop anymore without masks or go anywhere at all, really, without putting our mask on. And we have seen and we know that non-verbal communication is particularly challenging when we're wearing any form of PPE. It significantly reduces the ability for service users to see our body language and in particular facial expressions. Something to be mindful of, and where possible to adapt communication style appropriately. It might mean that we need to explain more. It's using much more verbal stuff and less reliance on facial expressions. Adapting communication style is especially important if you're going to be working with a service user who has hearing loss or is deaf. Looking at statistics, I think there are 12 million people in the UK with hearing loss, including an estimated 900,000 with severe or profound hearing loss. 70% of people over the age of 70 have hearing loss. So it's something that's important that we're all really aware of, that these people will be very heavily reliant on visual cues, such as lip reading and facial expressions, and they communicate for their communication. And this is lost, really, isn't it, when we're wearing PPE. So remote consultations, communicating when you have is particularly challenging. And I think it's important to remember things like the Equality Act at the moment and the need to make some reasonable adjustments to support people with disabilities where we can. Now, you won't be acting illegally if you remove a face mask and covering to communicate with someone who is deaf or has hearing loss, needs to be able to see your face to be able to communicate with you. However, you do need to be able to assess the risks of that. Think about the infection and risk of infection to you and to others before you do that, and continue to follow really that government advice and guidance on infection control. So you can adapt and remove masks if you need to, but we would really strongly advise you to think about the risk from infection at the moment. If you did do that, you don't have to remove PPE, and we can look for other ways of working around it. There is Action on Hearing Loss, does provide some guidance for health and social care professionals, and Holly's going to pop the link in the chat box there for you. Have a look at that, it's really useful, and it definitely explains ways of working around that. Big thing really is a lot more verbal communication is needed. They can't see and hear, see your facial expressions and things, so use verbal where you can, write things down where you need to, use interpreters if sign language is necessary and stuff. Make sure that those things are in place as much as you can. But really difficult and challenging times, we appreciate that. So that's a lot about communication. I'm conscious of the time, so I'm going to move very quickly now to social media and networking, something that we are all using much more of. I have a Facebook account, I have LinkedIn accounts, I have 2 Twitter accounts, one's for my personal use, one's for my professional use, but I'm very aware, I think, that anything I post online, that once I've posted it, I've lost control of it. So I'm just going to try and move now quickly to another quick Slido poll, just to get you really to tell me whether you do use social media. Again, you have to bear with us slightly for the delay here. Let us know whether you are someone who uses social media or not. So it's looking fairly Quite a lot of people using social media, probably unexpected there. Some of you not using it at all. Don't know how you're managing in some of these days. Most things seem to be happening on social media. So yeah, looking yeah, we've got quite a lot here. So we're really moving up towards 90% here of people online today using social media. It's probably no surprise there. So I think we all use it ourselves. At the HCPC, we use it. We try very much to post things on social media a lot. It's a way that we can keep you in touch with the developments that we're doing and things that are going on for us. So we would encourage you to use social media and to follow us. So I'm just going to end this question, and then I'm going to just move on to the next one, which is a bit of a challenge for you, really. For those of you who do use social media, would you be comfortable sharing your last post with your manager? So have a little think about the last post that you made and let me know whether you think that's something that you would share with your manager. I thought about mine when I was posing this question and thought, would I be happy to? Fortunately, for me, my last post was sharing the information for this webinar, so it was a professional post anyway, so I did feel pretty comfortable with that. I had a little think about whether I'd be happy to share my last personal one, and fortunately for me, I got to the conclusion that I too would be happy to share that. Some saying no, not surprising really. We want to keep our personal life personal, don't we? So we understand that, but it's really confident to see that a lot of you would feel very comfortable sharing your last post with your manager. So I'm just going to move on now then. We thought here we would just share a couple of things with you, some examples of things that we see in fitness to practice. We've had a rise in the volume of concerns that we're receiving about social media since the pandemic started. Probably not surprising because a lot has been happening on social media. It's been high profile around healthcare professionals because of what you're doing for us at the moment, because of your dedication, your commitment. And so we're seeing a bit of a rise, and we wanted to just share a couple of examples here that we think are avoidable. In fact, we think pretty much everything we see that relates to social media concerns are avoidable. Tweeting about your patients, be careful about confidentiality and the potential for family members and friends to recognise their family member as one of those patients that you've tweeted about. If your profession and your place of work is identified in your profile or previous posts, and then you post about someone that you've seen that day, you're describing them by age, by condition, there's a possibility that that patient could be identified. This can be quite distressing for family members. Different standards would be engaged here really in this first example. Obviously standard 2.7 that we're thinking about, where you must use all forms of communication appropriately and responsibly. 5.1, you must treat information about service users as confidential, and potentially 9.1, which is you must make sure that your conduct justifies public's trust and confidence in you and your profession. Second example we've got here, again, absolutely avoidable, posting of photographs that disclosed confidential information and adding annotations that were both disrespectful and derogatory about those patients that were being seen that day. Same standards really engaged here, so that's 2.7, the one we're exploring now, 5.1 and 9.1 again. But I think we're also here, we've got 1.1, which was you must treat service users and carers as individuals, respecting their privacy and dignity, and you must not discriminate, another standard there, and also being polite and considerate. I think that moment of posting, possibly as an outlet following a bad day, led to a number of breaches of the standards. A full fitness to practice investigation and hearing, and actually a caution for this registrant. It was avoidable. You know, don't use social media as your outlet for a bad day. Dark humour is something that we've been seeing on social media since the pandemic. We see lots of posts where, you know, a real increase in social media being used by healthcare professionals, and very much of it's about lifting your spirits, and very much of it is in good taste. Some is using dark humour, and I think it's probably important to remember that whilst you and your colleagues may appreciate and understand that dark humour because of the environments you're working in, because of the way that you work, members of the public aren't necessarily going to understand your dark humour and may be offended by it. I think thinking about members of the public who are losing family members at the moment to COVID, who've got very sick relatives that they can't see. So they're, we're all kind of working and living in very stressful times. So I think remember that social media is the public domain, and some of that dark humour needs to perhaps be more contained within your workplace and not shared on social media. Case studies, we produce some case studies, and Holly's going to put a link for those here. We've got blogs and particular guidance around social media. I think one of the most important things to think about is think before you post, definitely. So here's some of those top tips that are in the guidance that we have. Moving on, we've got case studies and stuff. Now the case studies are important, have a look at them. They provide some real positive examples of using social media to develop and share skills and knowledge, network with other professionals, engaging with the public about what you do, raising the profile of your profession. So do go and have a look at our case studies. They are positive, not all about negative stuff, so do go and have a look at those and see. And we've got a blog that's particularly about posting during this time. But I think I just want to kind of finish a little bit really by saying keep posting. Many of you do find using social media beneficial, and you can do so without any issues at all. So there's no reason why you shouldn't keep on posting with confidence. Using social media brings many, many benefits, gives you real ability to develop skills, share knowledge, helping the public to understand what you do, networking with other professionals. There's all sorts of benefits that come from it. So keep doing it, but just think before you post, and remember that you will lose control of it once you post it, and it's not always going to stay private. Really conscious of the time, and I'm sorry I'm running over a little, but I just want to kind of run through a few other bits of resources that we have for you before we finish. Just want to talk about your health and well-being. We're moving back into a very difficult time with the pandemic again. Hospital numbers are going up, people seeking healthcare are going up, certain lockdowns are happening in certain areas and stuff. If you are unwell yourself, do stop working, do take care of yourself, do seek help if you need it. We've got lots of resources in the COVID hub that will direct you to various support that you need for mental health and well-being. Do use them. And do take time out if you need it. Mentioned the standard of proficiency right at the beginning, and just want to talk now a little bit about the consultation that we have going on. We are proposing to make changes to every profession standard of proficiency, and you can go online now and have a look at what those proposals are. And if you have thoughts and views on them, whether you support them or don't, you're welcome to let us know through the consultation. I only have a few days really left for that now. It ends at the end of this month. Alongside that, we're also consulting on our new proposed corporate strategy. I think that runs to about the 2nd of November. So we've got a couple more days for that one. They're both contained in the same place on the website, and Holly's going to post a link to that. But we would really like to hear from you on both of those things. We have lots of resources online, so do use our website, do go to it and see. We've got things about meeting standards and hubs and things to use. Quick save the date. We will be back online doing the 3rd webinar for this series on the 4th of November at 2 p.m. That's going to be about scope of practice, so working within the limits of your skills and knowledge. We hope you can join us for that. Quick recap of what we have covered today. So we've talked a lot about communicating with service users, particularly using remote consultations and some PPE things to think about. And we've skipped through, I'm afraid, quite quickly, some of the social media networking stuff, but I hope that was important and helpful for you. Now I'm going to invite you to go back to Slido, if I can get it to work, just for a few questions again, just to evaluate really this webinar. So posting a question now, just to check your understanding again. So after this, hopefully that's come up now. After this session, how would you now rate your understanding of Standard 2 of the Standards of Conduct, Performance and Ethics? I'm hoping it's improved a little for those who were feeling a little less confident about it, and I hope that you heard what you hoped to hear if you were feeling really confident about it. So it's good for us to capture this. We need to know that actually what we're doing is helping and making a difference. So your feedback and answers to these questions are really quite important for us. Okay, got that coming in. Quite a lot more now up at the top end there from 5 onwards. That's really good to see. I'm glad it's helpful. Clarified some things for you. Those numbers keep moving around as people popping their answers in. Excellent, thank you. So we've got quite a few now, everybody 5 and upwards, which is really positive. I'm going to end that question and just move quickly on to the next one, which is really, let's put that up, really getting you to now tell us, I mean, before I was asking you to put a word in really that would help us understand how you view us at the HCPC. I couldn't get that slide to work earlier at the beginning, I'm afraid, so sorry, but now it'd be helpful to see which word comes to mind when you think about us, the HCPC. Brilliant, seeing some words here. Excellence, thank you very much. Really happy with that one. Professional, really pleased with that result too. Professionalism, excellent stuff. Responsible, safety, really positive things. Thank you very much for that feedback. Really appreciating that. Communicate clearly, standards, obviously we've really got that. Supportive, excellent. Thank you very much for that. If you can bear with us, there's just a couple more questions. This is going into our analysis really of the feedback for this session so that we can hopefully improve them as we go forward. Another question here, how likely are you to recommend this training to your colleagues? So how well did you find it? How helpful was it? Do you think you'll be encouraging others to watch it? There will be a recording of it. It will be available on our YouTube channel. So if you would recommend it, you're welcome to share the link. We'll send it on to you. Excellent. So again, we've got lots of people, all from 7 and above at the moment. So that's great news for us. Thank you very much for that. We will give you the link for this, so you will be able to share it with your colleagues. Certainly use it in your own CPD sessions and things, perhaps in your workplace. Okay, nearly there with the questions. Just bear with me slightly. Just 2 more to go. So has this session helped you reflect on your practice? So have you seen and heard things today that have made you sort of stop and think about the way that you're working, the way that you're doing things, and whether you could do them in a different way to improve that for your service users? Well, excellent. So far I've only got yeses coming in. I don't have any no's. So again, really brilliant stuff. Excellent. I'm waiting for a no, but I can't see any no's coming in at the moment, so that's really great news. I'm glad that it's helped you to reflect. Really important that we do that every now and then, and we stop and take stock of where we're at and what we might be able to do. So just bear with me. Our final question for this evening, has your knowledge of the role of the HCPC improved? So do you think you know more about us now as a result of this webinar, more about the things that we do, the resources that we offer, or has it not really helped? It was already good, some answering that it was already good, which is excellent. Quite a lot of yeses again, and so far no no's, so that's really positive for us and the work that we've been doing here at the HCPC. So that's brilliant, thank you very much. Now, just before you do go, very quickly want to share this slide because this shows you how you can get in touch with us. We've talked about social media, many of you using social media, some of you not. If we can encourage you onto social media, and if we can particularly encourage you to follow us, the usual sites, here are the details to do that. It's a great way to keep pace and keep track of the things that we're producing and coming out, events such as this, the new guidance, the COVID hub, etc. So do follow us on the social media sites and keep checking in with us. At the bottom of this slide here, you've got some important contact details for people if you want to get in touch with us. The professional liaison service, that's me and my colleagues, and the different events and webinars that we do. We've also got our policy team, which is Olivia and her colleagues. We've got registration and FTP if you needed to have any conversations with them. Just before we finish, and I'm almost on time, we just want to say thank you very much. Might not be standing on the doorstep at the moment clapping, but we do remain truly grateful for your commitment and dedication and all that you're doing at the moment to take care of us. You know, thank you very much. Thank you for taking the time out to listen to us today. And we're just going to say goodbye and have a good evening. Thank you.